Hey, this is Lynn. I want to welcome you. If you are new to my channel, I want to give you a little bit of a quick briefing on who I am. And then I'm going to go into the topic that I'm going to talk about today. So I am a retired nurse. I just recently retired due to Mast Cell Activation Syndrome that has pretty much taken over my life. And I have been starting on a journey on a carnivore diet, trying to lose weight. I'm morbidly obese and it's definitely affecting my health. The Mast Cell Activation Syndrome kind of put me over the edge. I'd been on medical leave for about 9 months when my job couldn't be held any longer. And so I am now retired. I'm 55 years old and I'm hoping that I have a lot of life ahead of me if I can get my health under control. But I wanted to talk today. Sorry, my hair is all messed up. I wanted to talk today about Mast Cell Activation Syndrome and give you a reason why maybe you should stick around, and maybe this may not be appropriate for everybody, but there are people that I think would benefit from this discussion. And so before you just click off and say, this doesn't apply to me, here are the reasons why I'm wanting to talk about this. So, well, first of all, because this is the condition I have, but it is considered rare according to the National Institutes of Health, but the leading experts about Mast Cell Activation Syndrome are suspecting that about 1 in 6 people actually have this condition. It's just not really well known at this point, and that happens a lot with illnesses. We don't know about them, or and then finally the medical science starts to figure out that, okay, wait a minute, there's a condition here that we haven't known about, and then let's learn about it, let's put a name to it, figure out how to diagnose it, how to treat it. That's kind of what's going on with Mast Cell Activation Syndrome. And it's an evolving understanding of this condition. It's not systemic mastocytosis, which is also a mast cell disease. It's a different type of mast cell disease. So when I think about who might benefit from sticking around and listening to this talk and learning more about Mast Cell Activation Syndrome, I think of people like myself. So over the course of my life, I have seen about 17 different specialists, because I'm one of these people that there's something wrong. Like, there's something wrong and there's something going on, but you can't figure out what it is. And you've seen a bunch of doctors and they've run a bunch of tests and they can't figure out what it is either. If you're one of those people that's frustrated because you don't have answers and sometimes you think you're going crazy, and you may have even gone down the mental health road trying to get help for all of the anxiety or the depression in your life. And often what happens is that nothing works. You may get a little bit better. Sometimes I feel like I'd have like a placebo effect, that I'd start on a new treatment that the doctor wanted to try, and I'd get a placebo effect and I'd think, oh, this is going to work, but then it just didn't. So that's where I'm coming from. I want to talk to those of you out there who are in that situation, who are frustrated because you don't have answers. Because up until last year, I was in the same situation. Now, Mast Cell Activation Syndrome is actually, they don't even know for sure now. I read it's definitely an immune disease, but there's some speculation that it possibly might be an autoimmune disease. Again, it's evolving. They don't necessarily know everything about this, but it is a disease of the immune system. Whether it's just an immune disease versus an autoimmune disease, it is a disease of the immune system. Now, mast cells we all have mast cells. Now, I'm going to put this into as layman terms as I can. I'm going to try to be super simple about explaining what this is and how it manifests. I'm not going to get tried not to get real nursey about it because doctors don't even know much about this. So what makes me think I do? I know what I've experienced, and I do know that people experience mast cell activation syndrome in different ways. Now, if you're new to my channel, and I appreciate all my recent subscribers, I always do my videos without any makeup because part of my mast cell activation syndrome is problems with my skin. So I want to be completely transparent about how I'm feeling. If I feel horrible, if I look horrible, I'm still going to go ahead and film a video. You're going to see me as I am. So I made a couple of short videos just earlier this week, one about how my horrible rosacea flare up. Yesterday I did an update about it, and so today still no makeup, but it's improving. So hopefully you can see that it's getting better. I took another shower today, but it was a really, really lukewarm shower, so it didn't really flare up. But I do all my videos without makeup so that you can see how my skin is doing on the carnivore diet. And I'm curious to see how my mast cell activation syndrome does on the carnivore diet. But mast cells, they're part of our immune system. And mast cells are in all of our tissues of the body. But most of our mast cells are in the tissues that are exposed to the external. So that doesn't just mean skin, although skin is a huge part of it. It means your lungs, because breath comes in, there is an outlet to the outside. So breath comes in and out, so that it is exposed to the external because you're breathing external air in. Also the GI tract, which is also considered exposed to external because you're putting things from the outside in, as opposed to your vascular system, which you have to puncture through your skin in order to get access to the vascular system. It doesn't have any obvious external opening. So that's kind of the explanation of what is an external tissue versus an internal tissue. So skin, lungs, GI tract are where most of the mast cells are. Mucosal membranes, sinuses, all of that. So mast cells are part of our body's natural defense system. It's really important. We have mast cells for a reason. They recognize foreign objects, foreign things in our bodies, and they alert our immune system to start reacting and to tackle that foreign pathogen or whatever it is. A lot of people would understand mast cell activation syndrome from the perspective of allergies. The most common chemical released by a mast cell is histamine. Now, mast cells release hundreds of chemicals into the body to help the immune system react. And histamine is the most common chemical that it produces. It produces tryptase, it produces heparin, it produces a whole bunch of chemicals. But most people can relate to histamine because if you have allergies, that's a histamine reaction. So for example, if you have a food allergy and you break out in hives, your mast cells are releasing histamine when exposed to that food, and your skin is reacting to the histamine release by breaking out in hives. If you have pollen allergies and all of a sudden your eyes start burning and your sinuses get all clogged, you start producing all this mucus, that's a histamine reaction. It's just why we take antihistamines if we have allergies. So with mast cell activation syndrome, the mast cells are releasing, called degranulating. They're releasing those chemicals, they're kind of rogue. They don't necessarily do it for the right reasons. They're releasing those chemicals for reasons that are abnormal. I don't know yet, and I don't know if science knows yet, how often they're releasing the chemicals for no reason versus they're releasing the chemicals because people with MCAS have higher levels of sensitivity. But I'm going to go through, there's a society, a mast cell society. So I'm going to go through some information from their website about mast cell disease. So they are classifying it as an immune system disease. technically. Again, I've read that the possibility that it may be an autoimmune disease. So people who have it can have dangerous and life-threatening reactions, including anaphylaxis. The symptoms are often very unpredictable. They can hit seemingly for no reason, and I've had that happen. It can happen to anybody at any age. It's not more female versus male. It does tend to get progressively worse with age. So I'm sure I've had this my whole life, but it has gotten worse as I've gotten older. It is often unrecognized, and it is underdiagnosed by doctors. And this is why I wanted to really draw attention to this, because, like I said, I just got diagnosed last year with this condition, but after I got diagnosed and I learned more about it, I thought, wait a minute, I've talked to patients so many times that are just like me. They're frustrated because they don't have any answers. And I wouldn't be surprised if they had Mast Cell Activation Syndrome. Dr. Lawrence Afrin, who is one of the leading specialists in MCAS, is the one who says possibly up to 1 in 6 people have it. So the likelihood that I'm going to be coming across other people in my lifetime who have this condition and don't know it is pretty high. So I want to raise awareness. But the triggers can vary. They can cause very severe reactions. They can cause more mild reactions. But according to the Mast Cell Society, about 70% of people who have it have a decreased ability to work and a decreased ability to perform their activities of daily living. That's such as, bathing, toileting, feeding themselves, taking care of themselves, doing household chores. And I can definitely attest to that. The last year has been pretty difficult for me. So I want to go through some of the symptoms. So since mast cells are in all of your body, they can affect a wide variety of things. Now, for me, one of my worst symptoms that I deal with is kind of an anaphylaxis type symptom. And it's interesting because of all the years I've been nursing, I always looked at anaphylaxis as the actual worst stage. I didn't even realize that anaphylaxis comes in stages. But the last stage of anaphylaxis is the one that we usually associate, where the throat swells shut, they need to use an EpiPen, person can go into shock. That's extremely life-threatening. I didn't even realize until I got diagnosed that there's actually, I think, 4 stages of anaphylaxis, and there's different symptoms that go with the different stages. And I didn't realize, but I've been having symptoms in the first 3 stages of anaphylaxis. I will have some throat swelling. My throat has never completely swelled, but I will have some throat swelling. I get nauseated. I get dizzy. I get flushing, itching. I don't have hives. I will have tachycardia. I will have horrible abdominal cramping. I'm trying to think. Yeah, I feel like I'm going to pass out. I have a bunch of different symptoms, but those are the worst symptoms that I have when I have a reaction. I've had to go to the ER because of throat swelling and tachycardia. And so it's scary. It's definitely can be really scary. But the symptoms, so for example, it can affect your central nervous system. Because you've got mast cells in your brain, every tissue of your body has mast cells. So it can cause headaches, nausea, vertigo, irritability, anxiety, and depression. Think of all the anxiety and depression out there that's being treated that possibly could be a mast cell disease issue. It can cause your blood pressure to be low. It can affect your appetite. It can cause cognitive dysfunction. I can definitely attest to that, because when I had last year, before I had to go out on a medical leave, when I was getting really bad because of an infection, my brain would freeze. I was working from home, doing a lot of triage, working in gastroenterology, hepatology, and working with some, very seriously ill patients, and on the phone with them during the day, all or 10 hours a day. And my brain would start to freeze, or I couldn't get my words out. And I found that because I had this abscess, it was an abscess on my chest. And it was a really bad infection, and I had to do 2 courses of antibiotics, and I had to go like every other day. The wound had to be drained and packed. It tunneled all the way to my chest. And so it was really stressful, and it was a really bad infection, and that triggered a huge MCAS flare. So I was working, and my cognitive function was getting worse and worse, and I couldn't be dealing with patients on the phone when I can't think. I'm supposed to be doing nursing assessment, and I'm supposed to be giving them instructions and advice. And, we have patients that call that need to go to the ER. And so it's really important for me to do a really thorough assessment. I couldn't do it. So that was really bad. It can cause thermal dysregulation. So your body temperature doesn't seem to want to regulate. You go from hot to cold, reduced motor control. So you may have problems with gait. You may have problems with dropping things. I definitely have had that problem. You can have cardiovascular symptoms. So your blood pressure can also be too high. You can have cardiac rhythm problems, tachycardia, which I've dealt with, orthostasis, which is basically your blood pressure likes to drop when you get up. Which will make you dizzy. So there's a symptom called POTS, postural orthostatic tachycardia syndrome. That's a lot of people with MCAS have POTS, and a lot of times they'll pass out, they'll faint. I've never fainted, but I've definitely felt like it. Skin issues. It affects the skin a lot. You can have itching, flushing, heat, like your skin's really hot, hives, pain, like your skin's really sensitive to touch. You can be pale, swelling. So that's how it affects the skin. Respiratory, it affects your respiratory system. You can have nasal congestion, runny nose, sneezing, itching, watering eyes. Those are a lot of allergy type symptoms. You can have bronchoconstriction. Those are very asthma type symptoms. You can have a lot of mucus production, wheezing, and shortness of breath. Menstrual for the women. See, I was diagnosed years ago with PCOS, polycystic ovarian syndrome. And, initially it was like in the early 90s when I was diagnosed. It was just the solution was to put you on birth control pills. So I did that. Later they found out that metformin works for PCOS. It never worked for me. My labs were not really always they weren't consistent with PCOS, but my symptoms were. So I don't know for sure how much MCAS had to do with my PCOS, because it can, and I noticed too with the gastrointestinal symptoms, MCAS gastrointestinal symptoms will be exactly like irritable bowel syndrome. So it's hard to tell. I mean, unless they go in there and do a colonoscopy and actually biopsy the tissue, they'll find extra mast cells if you have MCAS causing your GI problems. So it can be hard. Doctors, they don't know. They do their best. Diagnose you with one of the most obvious thing, and don't factor in that, it could be mast cell activation syndrome. So I don't know if my PCOS really is PCOS or if it's just a manifestation of the MCAS, but it can cause pelvic pain. It can cause problems with your period, PMS, and endometriosis. Gastrointestinal symptoms can be nausea, stomach aches, bloating, cramping, constipation, loose stools, leaky gut, food sensitivities, gut flora imbalances, which is SIBO, or Crohn's disease. And then in the bone marrow, increased mast cell production by the bone marrow, which can lead to mastocytosis. So I heard that it's really rare to go from mast cell activation syndrome to mastocytosis, which is too many mast cells. Mast cell activation syndrome is the right number of mast cells, but they are behaving badly, and systemic mastocytosis is too many mast cells. Very common to have a lot of crossover in symptoms. So anyways, think about all those symptoms I just went through and how many people have those symptoms. Now, you may have an explainable reason for those symptoms. So it's important to go to whatever the specialist is and rule out the most obvious thing, because you don't want to just jump to a conclusion that you're dealing with mast cell activation syndrome. But if the specialist has done all their whole workup and they don't have answers, or they think it's one thing, like, so for example, you get treated for, you get diagnosed with irritable bowel syndrome and they prescribe a treatment for you or a special diet for you and it's not working, or you get diagnosed with, something else and the treatment isn't working, then the question is, maybe you should have a workup for mast cell activation syndrome. So how do you do that? You go see an allergist. Hopefully you can find an allergist that's really familiar with the workup for mast cell activation syndrome. Now, with that said, it can take years to diagnose. The first time I actually saw an allergist for this was back in 2016, and I officially got diagnosed in 2022, because the tests that they order need to be done while you're having a reaction, and they want you to go get lab work done when you are in the middle of having a reaction. Now, for me, I would have horrible abdominal cramping. I wasn't going anywhere, and after I got the tests ordered, now one of them is a 24 urine collection test where you have to pick up a big jug and you have to collect your urine for a whole 24 hours. And the other one is a blood test. It's a tryptase test. And after those tests were ordered, the next 2 times I had a reaction, I was on vacation. I was back in the New England states. Actually, I was in Manhattan. And then my husband and I were going on a cruise to the New England states, and I had 2 reactions during that vacation, but I didn't go anywhere. I just was like flat on my back. I was miserable. No one was going to get me anywhere. So it's hard to get the diagnosis. I'm assuming you can hear my dog barking in the back. I don't know what he's barking at. He's probably just barking because no one's paying attention to him. So anyways, so as far as triggers for an MCAS reaction, one of my biggest triggers is heat, and it doesn't need to be super, super hot. Like I spent the first 45 years of my life in California, and in the Central Valley of California, it gets hot there. So the first time I really started to have what was kind of weird reaction was down in California, and my husband had a company picnic. And so I went to his company picnic 2 years in a row. And the first year I felt horrible, and it was really hot. It was like the first hot weekend of the year. And I thought, well, maybe it's just I didn't drink enough water and I was being affected by the heat because of that. But everyone else around me was fine. It didn't take me very long. Maybe within 30 minutes, I started to feel nauseated, kind of like a heat stroke type symptoms. So the second year, I decided to be proactive, and I had plenty of water with me. I had a hat so that I could make sure I kept the sun off my face. And I got the same reaction, but worse. Like I felt like I was going to pass out. I was so nauseated, and it was maybe within 20 minutes of getting there. I had to lay in the shade under a tree for about an hour before I could even muster up the strength to get to the car to go home. That was a really weird reaction. Most people don't react that quickly to heat. But I was in my 20s at the time, and I didn't really think anything of it. Back then, no one knew anything about MCAS anyways. So, fast forward to now, since 2013, we've been living up in Washington State, and it's really mild here. I can have that sort of a reaction if it's in maybe the mid 70s, especially if it's sunny. because UV light tends to be create a worse problem for me than if there's a lot of cloud cover. But if I get too much exposure to even mid 70s, I can start to have a reaction. So as far as the triggers go, there's a lot of triggers that could be a problem. So one of them is exercise. Now, if you actually watched my video from Monday where I did my results and I talked about I did gain a little bit of weight. The last part of my video, I talked about the exercise and overdoing it with exercise at this event that I went to last Saturday. That is a exercise intolerance is really common with people with MCAS. So if you find that exercise doesn't make you feel better, that it actually makes you feel worse, could be MCAS. Maybe not, but it's a real thing. There's different foods that can cause a problem. Now, I've found that I have to be careful with foods that are high in histamine. So here I am on a carnivore diet, and I can't really have bacon. I can't have aged cheeses, smoked cheeses, aged meats. I'll probably do a separate video just on the foods that I eat on this diet having MCAS. Because I can't just eat anything. I mean, egg whites are higher in histamine. So I have to be careful how many egg whites I have. I can have egg yolks. They're not a problem, but egg whites are high in histamine. So that's a whole other topic as far as food to eat. So if you're still with me and you want me to do a video on the eating, the way I eat with Mast Cell Activation Syndrome, I will do that. But alcohol is a problem. Some people have problems with city water, or they may have problems with bottled water. There's some drugs, contrast dyes. And it's funny too, because antihistamines are like a staple for people with MCAS. And so many of the antihistamines you get actually have red dye in them, which is ridiculous. Like, why, if you're dealing with people with allergic type reactions, why would you put red dye in the medication that they have to take? Makes no sense. So some of my medications I get at a compounding pharmacy. So that solves that problem. But you can have chemical sensitivity, odors, different odors can cause a problem, cigarette smoke, first or second hand, pesticides, herbicides, perfumes, scents, fumes from preparing foods can cause a problem, infection. So if you get a viral, bacterial, fungal infection can make mast cell activation syndrome worse. And one thing I've learned over the last year is that since my retirement was because of a worse, mast cell activation flare from an infection, I learned that after you have a big flare, you don't necessarily return to your previous baseline. And so far, that's been what's happened with me. My ability to function is not at my previous baseline before I got that infection, which is unfortunate. Again, which is why I had to retire. Emotional or physical stress can cause a reaction. Vibration, friction, or mechanical irritation to the skin. That's something that I have had a problem with in the past. Like, we go to church on Sunday, and for a while I was still on medical leave, I couldn't go into the service until after the music was done. I had to stand out, away from the service and during the music, just because of the vibration from the music would make me dizzy. So I can definitely attest to that. So some of the other triggers can be pain, pollen, environmental pollution, mold exposure, being tired, just fatigue. So it's important to make sure you get enough sleep. Sunlight, which I've already talked about. That's one of my big triggers. Hot or cold climates and sudden temperature changes. Absolutely. I can't take a hot shower. I will feel like I'm going to pass out. And so I have to be really careful with heat. Hormonal fluctuations can cause problems. So the triggers are vast and everybody is different. So if, I know my most common triggers, but yours may be different. Yours, there's some people who have like 3 items of food that they can eat because food is one of their biggest problems. I'm very fortunate that's not the case with me. I do have a more wide variety of food that I can eat. Now, since starting the carnivore diet, that amount of food has definitely narrowed down because of histamine levels in there. And food does have natural levels of histamine. Also, there's certain foods that are histamine liberators. So they will cause mast cells to liberate histamine more frequently. So you have to be really careful with those foods. So I've learned what foods are the worst for me, and I've been very limiting. And it's so sad because bacon is one of them. But anyways, I know this has been kind of a long video, and I know I didn't touch on everything regarding mast cell activation syndrome. There's so much information, and again, it's evolving as far as what's known about it. Getting diagnosed, there's different criteria that you have to beat to get diagnosed, and my tryptase levels were really high. Now, it turns out I also have something called hereditary alpha tryptosemia, which means when my mast cells degranulate and they release tryptase, my body produces extra copies. So that's a whole other discussion. But tryptase causes some of the symptoms that I have. And it also increases the likelihood of more severe anaphylaxis as the mast cell condition progresses. So I'm hoping that, like, I'm on medication, and the medication so far is making me less reactive, which is good. And when it comes to, getting diagnosed, first of all, they want to know, have your symptoms improved with antihistamines? So before I even got diagnosed, I would take antihistamines. I was making sure I was taking an H1 and an H2 blocker. So I take Allegra, I take Pepcid, and my symptoms get better. Now, when I have a more of an acute type of reaction, like my throat starts swelling and I start to feel like either tachycardia or dizziness or start to get nauseated, I have a chewable Pepcid and a rapid dissolve Claritin that I take. I chew the Pepcid and then I pop the rapid dissolve Claritin in my mouth, and I keep those with me. I have an EpiPen. I haven't needed to use the EpiPen, but those two that I use will take those, will stop the symptoms. I'll notice my throat the swelling will go down right away. I'll feel better. Now, the important thing is to get away from that trigger, whatever it may be. If I can identify it, I can't always identify it. Sometimes I just have to go lay down, and maybe it's fatigue. Maybe it's the temperature. It's frustrating. It makes it scary to branch out and go do things because you never know when something's going to happen. Now, I started on a medication called ketotifen, which is compounded. I'm also on a low-dose naltrexone, which is compounded, which helps with inflammation, especially brain inflammation. And those have definitely helped, and the ketotifen has helped me be less reactive. But the medication even is so very individual as far as, what works for one person might not work for another. And I did have to have a bone marrow biopsy last year because my tryptase levels were over 20. And so it wasn't completely clear whether I had mast cell activation syndrome or systemic mastocytosis. But most people do not have to get a bone marrow biopsy to get diagnosed. So, I was just one of the exceptions that had to get a bone marrow biopsy. So I'm trying to think if there's anything else. I'm probably going to think of other things that I should have talked about after after I end this video. But, it's a big topic, and I think that people who have mast cell activation syndrome, it's hard. It's hard because a lot of us are hermits, because it's like the world doesn't like us. It's like if you can think back to that movie with John Travolta. I think it was him had the boy in the bubble. We're not that bad, but that's kind of the situation. Our immune system is not completely shot like that situation, but it's frustrating because it's just easier to stay in our little cocoon environment that we know isn't going to cause an acute reaction. And that's why I was nervous about going to the event on Saturday, because it was a new environment and I didn't know whether or not I was going to have an acute reaction. I didn't, but I did have a lot of inflammation. Now, one thing about mast cell activation syndrome is it causes those chemicals that the mast cells release, they are inflammatory. Probably should have mentioned this at the beginning, but they are inflammatory. So with MCAS, there's systemic inflammation. Like, my inflammatory markers are always elevated. I'm really looking forward to seeing whether or not the carnivore diet, which is known to be anti-inflammatory, if it decreases my inflammatory markers. One of my worst MCAS symptoms that I deal with, other than the acute reactions, is just body pain, joint pain, bone pain, muscle pain, just pain all the time. It's kind of like I feel like I'm 80 years old. I've noticed with the carnivore diet that that's improved. So I hope that that means that this is helping my inflammation. I haven't gotten any follow-up blood work yet, but I'm really looking forward to seeing what happens with my inflammatory markers. But anyways, I think I'll kind of stop there, because there's, again, a lot to talk about with mast cell activation syndrome. I think the takeaway is, for anyone who's still with me and who's watching this, is that if you are in this situation like I was in, and you're very frustrated because you've seen so many different specialists, nobody can tell you what's wrong with you. And if any of this that I've talked about sounds familiar to you, I would go see an allergist and ask them about a workup for mast cell activation syndrome. They will probably suggest that you start trying to be on antihistamines and see if that helps. A low histamine diet could potentially help. If you're a carnivore, take the higher histamine foods out of your diet and see if that helps. But I know that it's important to raise awareness about this condition, and that there's a lot more people that have it out there and don't even realize it. And there is treatment. I am seeing improvement. And I think that the more awareness is raised about this, and the more people get accurately diagnosed, the more money is going to be funneled into the science behind it and learning about how to treat it. So anyways, I know that this was a really long video, but I hope it was meaningful, and I hope everyone's having a wonderful day, and I'll keep you posted on how I'm doing with my MCAS. And my skin is a big indicator. Inflammation really settles into my skin first, big time, and my joints and my muscles and my bones. And but I will keep everyone posted on how I'm doing with my MCAS, in addition to how my weight is doing with my carnivore diet and how my inflammation is doing and all that. So have a wonderful day. Bye-bye.